When people ask, why should we believe your commitment to the health service or to ethnic communities, they needn't take my word. Look around them in their own world, in their own communities. They will see more capacity, they will see more hospitals, more equipment, more nurses, more doctors, many of them, thousands of them, from the ethnic communities themselves. Secondly, they will see more personal choice and information being passed down to the patients as individuals and as groups. And thirdly, this government's commitment towards addressing inequalities in the health service. Equal access to healthcare free at the point of need and a fair chance for everybody is central to the values of the NHS. If we do not deliver that to the ethnic communities as well as to women and to those from working class people, we will have failed the values of the NHS.
Well, I went into hospital and what it was, I was drugged up to the eyeballs and I was saliving from my mouth. And I had to put my mouth down to the table to eat my food. And I told them, I said, could you change my medication so this doesn't happen? And they said, no, that's your medication you're on and you're on that. There's nothing you can do about it. When they see big black young men, they think they're a threat. So they think it's got more to do with managing the patients in the hospital. So they say, if we drug them up, they'll be less active and less of a threat, so they just drug them up and leave them to do what they can do.
The programme is basically designed for areas, first of all, where there are higher ethnic minority populations. It's basically to make sure that the health service does respond to the different needs of the communities, both in terms of its workforce planning and in terms of its service planning.
Central Manchester was approached to see if we would be interested in being part of the Transformational Change programme as a trust that is based in an area that is really vibrant, diverse, has a large minority ethnic population, and we felt that it was really important to ensure that all our services are accessible to our population. We also felt that by being part of the transformational change process wasn't just about focusing on black and minority ethnic communities, but it means that we can develop and improve our services for all our communities.
It also ties in, from my point of view, to our status as a teaching primary care trust, where issues around learning, training, engaging different communities, lifelong learning, and so on, are all really important in improving the health service. And so it's really up to us to make it successful. The programme is just the instrument.
Black and minority ethnic communities' needs are not different. The needs are the same. We need information, we need respect, we need time, we need appropriate, timely services delivered. How those services are delivered is the issue.
A lot of assumptions are being made in the wards by some of the senior staff. And an example I can give is when a patient was discharged, and this patient actually went in with heel ulcer. From that, they found that he actually had cancer of the lungs. According to the hospital, the family were explained, this is what your father's got. I think this is where the danger is, because when patients only have little understanding of English, they're very good at just saying yes, 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 when actually they've not fully understood what's been said. What the family thought was, this is it. Their dad's been in hospital, he's been treated, he's been given the medication is now finished, now dad will get better. They heard about the cancer but did not fully understand about morphine and how this was helping their dad. And they had just given him Panadol over the weekend to help him with his pain. Now this patient was in pain unnecessarily.
for us, it was actually demonstrating that we really were going to be very equitable around employment. People had felt that in the past, good black applicants for jobs hadn't got jobs, and what we were able to show fairly early on, what by being fair, were that we were able to make some appointments to new posts, which in the past people felt a black person wouldn't have stood a chance of getting those.
Almost every family that you speak to will have had someone who stayed in the hospital. Now, if their experience of that hospital stay has not been positive, they will not want any of their families going in and being a nurse or a midwife.
There is a huge resistance around apprenticeship, a huge resistance around mentoring. And this is right through all the mainstream, all the big places. The private sector deals with it better. A biscuit company can deal with that, understand the benefit of training local people to do the job. We can't. I don't understand why. Or we do it in such a small way that it's not effective.
Managing budgets is fine. How that is managed, what is coming out of that budget is the real questions. I can balance the books at the end of the day. What did I buy out of it? Did I buy bananas or did I buy a caviar out of it?
So even if it comes with little resource, which it does effectively, to engage in a subject as large as this, in signing up to it we're committing ourselves to something, and something which we do need to therefore concentrate on.
There is huge wealth of knowledge and ability, and it might actually help to actually understand that you don't need money to improve things always. Communication is really important, but you must want it, and you must prioritize that. And it's not about language barrier, it's about power. It is very much, access to information is also about power. It's how you receive somebody as a human being and how you deal with them.
This is about change, and change is a permanent thing. It's not something temporary. So that's why it has to fit in with your organisational values in any case. I think the importance of this is actually we are supposed to be moving things forward in a way which they can then apply to other organisations and generally be a good practice guide for organisations who, if you like, don't live in such a diverse community but do still want to respond to the diversity of their community. It's very difficult for an area which has quite a small ethnic minority community to justify a programme which actually addresses their needs. But in some ways it can be even more vital in those areas because it's a small community, and it's always difficult to address things to very small communities of whatever nature they are.
The transformational change process is different and more exciting because I think it looks at race as part of the whole. A lot of the initiatives that have been preceding it, if you like, have always been an add-on. They've always been, you know, we've got our generic health services and then we'll look at services for black and minority ethnic communities. This is about looking at our core services. It's about changing our culture. It's about changing the way we think about providing health services, about how we develop our relationship with our communities and work in partnership. And I think if we can make the transformational change process work and we can change our cultures, then we can actually provide services that are effective, meet the needs of our population as a whole, not just those specific needs of black and minority ethnic communities.
I think it's about enabling and empowering the communities and letting the community believe in themselves and believe in their local services and believe in their local health services, that this is something deliverable, this can happen, this is not a dream, this can be reality if we all work together.
The National Health Service was formed because the people of this country, of both sexes, all ages, and from all ethnic backgrounds, fought together against Nazism 60 years ago. And having defeated that poisonous racist regime, they then said, we will now fight together against another great scourge, and that is illness and disease. So right from the beginning, the whole collective approach of bringing people together, irrespective of their ethnic background, and giving everybody an equal chance was central to values in the NHS.
I couldn't say I have.